lumps or varus going on anywhere in the knees and the feet. Okay, look at them from the side. Do we have any hyperextension going on? So understanding what's happening at the knee. Okay, could have him walk, step to the table and back, watch what's happening. Okay, again, the focus right now is on the knee. Then question him, point to your pain. When does that pain occur? Okay, and again, if he said stairs, let's use different heights. Okay, so we have something we can measure progress on. Okay, all right, then I'm gonna have him lay down on his upright posture. Now, when he's laying here, okay, with his knee extended, what position is this of the patellofemoral joint?
Open.
Pardon me?
Open packed.
Open packed. What's another name for that?
Loose.
The resting position or loose packed position. Okay. So now what we want to do is we want to take, sorry, did I tickle you?
I have a mosquito bite there.
Is it hurting?
Oh, no, you're good. It's okay.
Okay. Okay. Don't do that because I'm
Okay.
going to have you do that later.
Sounds good.
Okay. So now what we're going to do is, well, since he already did that, we know where the patella is, okay? So I'm just gonna lightly keep my fingers on it, and I'm gonna say, okay, now do a quad set, okay? And relax, and a quad set, and relax. What would I be looking for?
To see if the patella tracks superiorly with the contraction.
Well, it's gonna track superiorly, it better,
Okay.
okay? But what abnormality am I looking for in tracking? Having it, does it track lateral? Okay, and sometimes when somebody really has a lateral tracking patella, it almost looks like it jumps. Sometimes I've heard it called a J sign because it kind of goes like out to the side and up. Okay, so go ahead and do that again. So does his patella track abnormally? No, his doesn't. Okay, relax. All right, and my fingers on there are just helping me with my visual and of course also feeling it. Okay, so we know this is the loose packed, open packed resting position. So I should be able to move that patella around pretty freely and not be causing any compression. So I'm going to move it medial, lateral, and I'm going to tip it up and down. Okay, so more importantly, I'm looking medial and lateral. Somebody who's got tight lateral structures, okay, I could come lateral, but I might not be able to even glide it medially. Okay. And the other thing you're looking at, if it's indeed resting correctly in the groove and doesn't have any abnormal pull on it, is when I feel it, okay, I should be able not just to feel the edge of it, but just kind of slightly the underside, okay? And I can definitely feel the underside. I'm not digging under there, okay? But just around the edge, I can get under a little bit. Do you know what I mean? Okay, so I can move it laterally and medially, no problem. I feel the edges very distinctly, and on both sides, I can get right under, okay? Don't have to, I'm not pushing hard, right?
No.
Don't have to push hard, just be able to see if you can get underneath there, okay? All right, so again, a lateral tracking patella is the most common malalignment, okay? I've never seen a medial tracking. That might be maybe after a trauma or something, okay? But it's not gonna occur due to tight structures, okay? All right, taping stuff. Oops. Okay. These are specifically for McConnell taping. And I even remembered to get left-handed scissors. Okay. So we have two types of tape. And I'm going to put this nice cold alcohol wipe underneath so it sticks nicely. Ready?
Yep.
Okay, you want to do the patella and from lateral to medial joint line. Alright. So we have two different types of tape. We have white tape, that's also called the coverall. Okay? This is the tape that goes next to the skin. Okay, it's sticky, but it's not horrendously sticky, and it protects the skin. This is called leuco tape, so this kind of looks like that stuff they were tearing for athletic tape, and this is probably very akin to what athletic tape is. Okay? This, and you can feel, well, this part might be dried in the beginning there. Yeah, I can't do what they say. This is not intended to go on the skin. This is intended to tape over the cover roll, the white tape, okay? All right, so what we want to get is a piece of this tape. It's gonna go right across mid-patella, see? And if you get it joint line to joint line, see, you'll have the right length there. And you just lay it down, smoother than that. Okay. We're not stretching it, pulling it into place, it just lays down on top of the skin. Okay. Now, what we're gonna do with this tape is this is what's gonna try to pull that patella biomechanically correct. So, again, we're assuming he has this left lateral tracking patella. So we want to tug it medially. So then when he gets up off the table and he walks and he goes up those stairs, when he does a squat, whatever his sign is, okay, he will not feel the pain because it will now be tracking in the correct place. Okay, so I want you guys to do this and practice it. I don't want you to, leave the tape on a long time because we're pulling excessively medially on you guys. Okay? All right, so when we put the tape on, the edge of the tape is going to go in mid-patella. Okay, not here, not here. Why? This is a very important part of placing this piece of tape. Why do I want to ensure that it's mid-patella and not on the medial or the lateral edge? Compression. Okay. Yes? Can you give me more?
Could it,
Oh, go
no,
ahead.
I was just gonna say, could it cause that end to come up?
Okay. So if you put it medially, it's going to push the medial side down and compress the medial side. If you put it too far laterally, it's going to push that side down. If you get it nice and in the middle of the patella, it's going to cause a glide, and that's what we want. Okay. All right. So I'm going to, do fancy measurement here. So from there, about there. This one is not going to be a big piece of tape, because we want it to stay on the white tape. If necessary, you can make the white tape a little bit longer, especially on the medial side. Okay. So here's the edges of his patella. I'm going to tack it down right mid-patella. Now what I'm going to do is to bunch up this side and strongly pull that, and then tape it down. So we see that? If you've got that going on, you know you've got at least some medial pull to it. Then certainly once that's on, you can have him right here, do a quad set, look at how the patella goes, have him get up, check out his asterisk sign or his starting point of his pain. What?
Nothing. He just looked at me.
I thought it came off for a second.
The switch part came out.
Okay, it did, yeah. And this is new tape, so I'm not sure why that's sticking good. It's you. It's your fault. All right. So again, then, we go through, we check it. Oh, it's good. I got it pulled over. Now we're going to go through exercises. Okay. So one of the things that we would look at in exercises, Amy, would you give me look at some exercises that focus things on the VMO, okay? So here's a couple of different things that you can do. Okay? So I'm going to have you bend your knees up a little bit, just a little bit. Okay, both knees. Okay, put this in there, squish it together. So adduction first, now push down into extension and a quad set. You can start lower with just a quad set. Okay, so squish, quad set, and then you do it opposite. Relax the quad set, then relax the adduction. Okay, so squish, down, then up, unsquish. Okay, so that's one exercise. You could do that with pillow, you can do it with one of the balls in there. Okay. Other exercise to help to focus on the VMO would be to say, turn your toes out, go into external rotation. Now do a straight leg raise. Okay, again, to more emphasize the VMO, and you could put a weight or manual resistance on there as well. Or doing leg press machines, have them do it with external rotation at the hip. What else could we do to try to strengthen the VMO? Something we did last semester.
Russian? Can you use Russian in this one?
Okay, well, Easton.
Easton.
Okay, which form? Could be Russian. Okay, remember we went through those and everybody reacts differently. So we could use E-stem specific to the VMO to try to strengthen that up. And then of course whatever other activities, interventions the patient needs for that.